I appreciate that I'm here as, well, a bit like a Christian to the Lion's Den, really, as a regulator. So what I will say is that what I'm going to be presenting here is not the view of the Trading Standards Department that I work for, or of the Trading Standards Institute that I'm lead officer for. It is my view as a smoker and a vapor, and somebody who's seeking to move from smoking to vaping exclusively. And therefore, I kind of take a oh, you can hear me now. I take a slightly different view to many of my colleagues on these products, because at the end of the day, I think that there is a massive potential for harm reduction of those of us who, like me, have been smoking for, I think, 35 years, who still can't stop. And this is my best opportunity to at least stop using tobacco on a daily basis. So, I'm going to try and make this make the presentation as short as possible, because I appreciate there's going to be quite a few questions. The technology, as usual, is letting me down. Yay! Thank you. So, growth and development of vaping products. I don't need to go over this in any great detail. You all know, because you're all involved in the industry. It's massive. It becomes a massiv task for anybody to regulate this, and it becomes an even bigger task to regulate it in large single markets like the UK and large markets like the US. As far as I can tell, there's an exponential growth in demand. I don't know of any smoker friend who's not at least trying vaping. Most of them are still at the initial stages of using the disposable product that you buy in Tesco or Asda or what have you, and they're not getting the satisfaction out of it which I know you can get by using a more sophisticated product. There's a massive growth in producers and distributors in a global marketplace. We've got to consider the regulation of vaping products, e-cigarettes, call them what you want, within a global context, not just Europe, not just US, because at the end of the day, we're all global consumers now. You can buy anything. With the growth of e-commerce, we've got to consider these products to exist in a global marketplace. There's also rapid development of products. I've got 3 or 4 different products, all of which are at different stages of doing the same thing, but I suspect that in 2-3 months' time, I should be purchasing yet another one, which will be even better. It's a diverse marketplace. Diverse market base, in fact. There are some people who buy products because they want to try them. There are some people who are buying them as a partial substitute to tobacco, i.e. they smoke less cigarettes, but vape some of the time. There are those people who buy them to be able to get their nicotine indoors or at home. As smoking has become less and less socially acceptable, the demand for these increases. There's confusion in public health. I mean, that's the understatement of the year, really. The more I look into this subject, and I've been looking into this subject for about 4 years when I first met Catherine from ACETA and started to look into the safety of it. Public health and health professionals do not know what to make of this product, because they have this paradigm of, well, it looks like smoking and smokers enjoy it, so it must be bad, it must be really bad in that case. And these people influence public policy, they influence enforcement policy, they influence law. And this is why we've arrived at the situation where we're at the moment, because there is this confusion. Nobody can give the definitive answer, and we're not going to know the definitive answer as to what harm these products could potentially cause for 20 years, because by then there'll be people who've been vaping for 25 years. But in the meantime, we've got to use inductive reasoning to say, well, at the end of the day, it doesn't contain all the same poisons as tobacco smoke. It only contains nicotine. How poisonous is nicotine? Well, there's various schools of thought on that, but I don't think any of the medical professionals can say, well, having nicotine is as harmful as smoking tobacco. But this confusion is the backdrop against which the regulators have got to work. There's safety confusion. How safe is it? The other added complication to that is here we've just considered tobacco product regulation or regulation in relation to the atomizer itself or the e-liquid. There are other aspects of safety regulation which are equally important when it comes to this product. Batteries, chargers, the restriction on certain substances being sent through the mail or, child-proof containers for them and everything. The media seems to be making it a big issue at the moment out of e-cig batteries catching fire. Now, I know as a safety professional, batteries catch fire. It's got nothing at all to do with e-cigarettes. The number of people who use an incompatible charger with an incompatible battery on a product is growing all of the time as we get more and more battery-powered products with more and more variations in rechargeability, charging cycles and everything like that. So as an enforcer, I've got to consider the risk associated with that. And at the moment, in terms of e-cigarettes, vaping products, I would say the biggest risk, and the risk that we need to take most notice of as enforcers, is the electrical safety and the battery safety of the product. In terms of poisoning, I know that there have been reports of children ingesting amounts of e-liquid. That is a serious matter, but that's also a cultural issue that parents will keep other poisons out of the way. They need to be aware that this is a poison as well. It's a behavioural issue. There's regulatory confusion. In the UK, there are some officers in my profession who think, well, that's a medicinal product because it's a smoking cessation device. Not unless it claims to be, it isn't. Tobacco Products Directive. I could have stood up here and talked about how I think that's going to be implemented. The answer is I don't know at the end of the day, and I don't know what the landscape's going to look like in 2 years' time. But I do know that the General Product Safety Regulations, at the moment, when people say, oh, it's not a regulated product, it is. The vaping product, the e-liquid, they're governed by the General Product Safety Regulations, which, General Product Safety Directive, which gives a high level of consumer expectation of safety and requires traceability, evidence that the product is safe when it reaches the marketplace. It places quite onerous obligations on distributors, and as soon as regulators actually take that on board, then they can approach the safety of these products with an open mind. UN involvement, I don't need to say any more about that, apart from, in my view, as both a regulator and a consumer of these products, it's not helpful. So, the regulatory background. What we're talking about here, the Tobacco Products Directive, is the single market for goods. It's a massive market, and it has a massive number of routes into it. The market surveillance within Europe is only as strong as the weakest link. So whilst we have Ports Project market surveillance in the UK, keeping a close eye on products that are coming in from third countries, if a product is imported through another member state that doesn't have the same market surveillance enforcement, then there's nothing we can do about it. And if it's got a CE mark on it, then we can't stop it coming in unless we know that it's already unsafe. We need to address that as a market surveillance authority for the whole of Europe, not just in individual countries. Chemical labelling. I think the industry has more or less got a handle on that now, in terms of both child-resistant packaging, hazard labelling and everything like that. I'm not coming across many products now, refillable products, which aren't labelled in a way that, whilst it may not technically comply with all of the relevant requirements, is at least communicating the nature of those requirements to the consumer so they can take appropriate action. Electrical and electronic products. The more electronic products that we each own, the more this is going to become a problem, because there's no uniformity of charging cycles, of charger types, of whether or not a battery has overload protection or whether or not a charger has overload protection. You marry a battery without overload protection with a charger without overload protection, and it's the wrong charging cycle, then you have the potential for a fire. Batteries are unstable, but e-cigarettes are no different from any other electronic product in that respect. And the growth of electronic products in the last 10 years, I mean, I don't know about anybody else here, but I generally have to carry 3 phones and an iPad around with me now just to do business. It's going to become more and more of a problem, but it's something that the industry needs to be aware of. As part of any risk assessment on your product, forget the Tobacco Products Directive for a moment, you need to make sure it's electrically safe. And that battery, if it can be charged with any other charger, that it will not present a hazard with that charger. Tobacco Products Directive, I think we've done that to death now. It's going to create problems, not just for the industry, but for enforcement authorities throughout Europe. There are going to be some who get mixed up with American requirements as well. I have no doubt that it's a challenging time ahead for both the regulators and the industry, but working together, I think we can get through it. Public health and national tobacco control measures. This is not something that I'm directly involved in as a trading standards professional, but the product does infringe on these areas, and seeing these products now being banned on aircraft. I flew to the US a couple of weeks ago, and Virgin are very, very clear now, you cannot use this product on their aircraft. I don't know why. They didn't know why either when I asked. But this is becoming increasingly a problem that, as vaping becomes more and more of gains more and more social credence, there are pubs banning it. Wales are looking at regulating it as if it's smoking. Well, that doesn't do anybody any good, in my view, because part of the attraction to get people off tobacco in using this product is you don't have to go outside in the pouring rain and use it. If you do, and I mean, I can say from my own experience, if I have to go outside, then chances are I'll actually smoke a cigarette rather than use my e-cigarette. Smoking cessation legislation. I don't know what it's like in other countries, but in the UK, people like smoke-free are very, very confused over this product. The same as health professionals. Some are saying, oh, it's a good thing. Others are saying, no, it's a bad thing. And we don't know what the outcome is going to be. But I do know that they are as confused as the regulators. And age restrictions. I think that we would all accept that it's not a good idea to be supplying a product which some people consider a gateway product, I'm not sure, to under 18s. And the industry has been very, very effective in self-regulating that prior to legislation coming in. So the organisational background. Market surveillance authorities. I work for a small market surveillance authority in the UK, Gloucestershire County Council, population 500,000 people. I'm one of 320 different market surveillance authorities in this country, which as of yet are not fully coordinated in the work that they do because they're based at a local level. It's the same for all the other market surveillance authorities in Europe, as I understand it. The difference in the UK is we're very locally based but take a holistic approach to consumer product safety, whereas in certain other countries, Germany, for example, they have specific regional inspectorates for specific products. And this product, for instance, will be caught by a number of different inspectorates in Germany. The electrical safety side will be governed by the Electrical Safety Inspectorate, electromagnetic compatibility by another inspectorate, chemical safety by another inspectorate, and then the tobacco angle by yet another inspectorate. How do these people work together? And the simple answer is at the moment they're not doing so, and to effectively regulate this product, we need to. I'm fortunate in the fact that I chair a national product safety panel in the UK, and therefore I can try, within the UK at least, to form a national policy and a national approach to this. But I don't know how other member states would do it. And this product is such a growth product, I think that it's worth, at some stage, the Commission actually getting together the market surveillance professionals involved throughout Europe to get together and actually discuss it as an administrative cooperation group, as they do with things like electrical products, EMC, machinery. We're a global marketplace, as I said. So how do we regulate a global marketplace? We can regulate what comes in, but can we regulate what consumers get? Consumers in this particular product sector are highly motivated to getting what they want. And therefore, if I as a regulator say, well, you can't sell that anymore, and you can't buy that anymore, then they will go online or they will go abroad and they will buy it. And the reason they're highly motivated is because it's keeping them off tobacco in many cases, or reducing their tobacco use. I know people who, would do almost anything to curtail any keep curtailing their tobacco use. So, in terms of non-compliant product coming in, air intelligence is poor. I'll say that with a tongue-in-cheek. The information we have on what's right and what's incorrect, what complies, what doesn't, what's safe, what isn't, is very, very poor. At the moment, it's a massive marketplace, and we are a tiny market surveillance authority. And that's true of all market surveillance authorities. They've all shrunk due to austerity measures. And whether you agree with that or not, there is an economic impact to a market surveillance authority's inability to do effective market surveillance and remove non-compliant products from the market if they find them, if they haven't got any manpower, or if they haven't got any money to pursue that through the court if it's taken through the courts. It's the same as in the US. This is probably going to come down to trading standards as a competent authority. Number one, I don't think trading standards in general will be competent authorities without a lot of training, without a lot of input. But secondly, it's something else on the plate. I'm responsible in Gloucestershire for the regulation, or the safety regulation of all consumer products purchased in that county, all consumer products manufactured or imported into that county. That's a county of 500,000 people. How can we do any extra on those resources? There's also priorities. My priority now, according to my elected representatives who tell me what I'm doing and what I'm not doing, is protecting vulnerable consumers in relation to unsafe products. Does this fit in with either of that? Well, no. You've not got a vulnerable consumer, and you've certainly not got an unsafe product. You might have a non-compliant product within the Tobacco Products Directive, but proving that it's unsafe is another matter. So in terms of the risk presented, can I justify diverting my resources to it? Probably not. So what I'm saying to you is that there are incredible difficulties in terms of you guys are here because you want to comply, but the people who aren't here probably don't. And whether or not we've got the resources to do anything about them is open to question. And we need you guys to be our advocates in that respect, saying there's an economic cost to not doing this work as well as any other cost. Import controls. Well, at the moment, it's patchy. It's good in the UK, it's good in some other member states, but it's not good in all member states. and non-compliant product will come in through the easiest possible port of call. Challenges presented by classifying vaping products as tobacco. For me, it's created a regulatory illusion that it's something it's not. I've had discussions with fellow professionals who've said, well, it's in the Tobacco Products Directive, so it must be the same as tobacco now. And that illusion's going to exist with an awful lot of market surveillance officers, and they're going to treat it the same as that, and it shouldn't be as far as I'm concerned. Current regulatory and public health confusion between tobacco, smoking cessation, smoking substitution. I don't know what anybody else's experience is, but hearing Oliver beforehand, I don't think a lot of people start to use vaping products to stop being a nicotine addict. They use them to substitute a very harmful product for one which, at the moment, we have no evidence directly of, or we have very little evidence directly of the harm or non-harm. But we know, I can say hand on heart that vaping is less unsafe than smoking tobacco. And that's a message which professionals, both within market surveillance and public health, aren't always communicating. My big worry is if you over-regulate this market, you're going to drive people back to tobacco. And that's something that concerns me greatly. If I can't get the vaping product that I want, then, it's probably easier to go out and buy 20 of my favourite brand. And there's an awful lot of people in the same position. So, we need to, as a regulator, I'm going to be an advocate in respect of that, saying, if you remove products that people want off the market that aren't unsafe, but they really, really want them, then probably they're going to go back to something far more harmful. Abstentionists will use it as an excuse to treat vaping the same as smoking, discouraging its use. We're already seeing evidence of that. That, again, worries me. That's why I don't think it should be considered as tobacco. Public confusion with the harm reduction potential of vaping. It's already been touched on before, but there is the potential for regulating it as a tobacco product to stifle innovation. And to be honest, the innovations are what have kept me in this market, or kept me as a consumer of this market, because there's always something new. It's all good fun. So what comes next? We don't know what comes next. I'm here to try and explain the next steps, and all I'm saying is that there's lots and lots of confusion. It's a new industry, it's a dynamic industry, and I think you have the capacity to drive rather than be driven. I'm a convert, and to be honest, the more people who become converted to it as a harm reduction strategy, I think the better. In terms of actual day-to-day enforcement, resources and powers, I don't know what powers we're going to have yet under the Tobacco Products Directive, because that will be national legislation. I do know that if I've got a dangerous vaping product at the moment, I can use general product safety regulations made under the General Product Safety Directive to remove it from the market and even oblige a recall if the risk presented by that product reaches that threshold. I'm not sure I'm going to have that with the Tobacco Products Directive, because tobacco products are specifically excluded from product safety legislation, because otherwise you couldn't sell them. So I'm not quite sure how that's going to pan out. Some member states, the resources for enforcement will be based at local, national, regional. And as I say, this is a cross-cutting product. It will, in many member states, be regulated by more than one regulator. Most, and I'm not talking about e-liquids now, I'm talking about the manufactured atomizers and things like that. As far as I understand it, most of them are imported. How do we take that control back to the factory? How do we have that traceability? And that's some, traceability. If you have a traceable product, you will comply with, and you've complied with what it says in the Tobacco Products Directive. You can't go too far wrong, regardless of your local regulatory framework. But I don't just mean the traceability of the e-liquid, I mean the traceability of the atomizer, I mean the traceability of the battery and of any charger. Again, what we also need to consider is personal imports. If regulators work too hard at this and remove remove lots of products from the market which people demand, they will go elsewhere to get them. And if they do that, then it's been a pointless exercise. It's the same as cigarettes, tobacco now. The cessationist lobby have managed to get the price of tobacco to a level where they believe it discourages its use. But what that's done, in effect, is just create a massive market for black market tobacco. And, I don't know about other cities, but in Gloucester, for instance, there are 20 or so shops which, if you know them well enough, you can get your Ukrainian cigarettes for £3 a packet. And so pricing tobacco at a particular level hasn't discouraged its use, it's just created a different market. And my concern is that too rigorous enforcement of any regulation in relation to e-cigarette products will do exactly the same, create a secondary market. I believe that the General Product Safety Regulation is strong enough to regulate these products and wouldn't be so prohibitive as to remove that many products from the market. It would, standardisation would allow it to move on within certain parameters. Right, I'm aware that there's probably a lot of questions for me, so I'll open the floor.